So, what are the junior doctors asking for? Their pay can range from just over £29,000 to £58,000 a year, with the average about £55,000 a year. The British Medical Association is asking for a pay rise of 35% to bring salaries back to 2008-2009 levels, calling this pay restoration. Between then and 2022, in cash terms, junior doctors' pay rose by nearly 20%, but prices have risen much more. But by how much is open to debate. The BMA uses the Retail Price Index of Inflation, which suggests prices rose about 58% in that time period. By contrast, the Consumer Price Index, which remains the most common measure of inflation, particularly for pay negotiations, rose 40% between 2008 and 2022. This would mean that junior doctors' pay fell 16% in that time, compared to the 26% that the BMA says, taking a 19% pay rise to restore it. Oh, now the Health Secretary, Steve Barclay, says he stands ready to talk, but says he can't meet their demands as they stand.
We want to reach a fair and reasonable settlement with junior doctors. We recognise the hugely important role that they play within the NHS. That's why we stand ready to have meaningful and constructive talks with them, as we have had with other health unions, as we have in terms of responding at the budget to concerns from doctors regarding their pensions. So we are ready to have discussions with them, but clearly a demand for 35%, over £20,000 for some junior doctors is not fair or reasonable, and that is why we've not been able to make progress so far. But we want to engage constructively. We recognise junior doctors have been under significant pressure, particularly from the pandemic, and we want to work with them to find a fair and reasonable settlement.
Sky's Matthew Thompson is at University College London Hospital with the latest.
Widespread dismay across the country. The papers are full of stories. Sky News have been reporting on a number of cases of people who've perhaps been waiting weeks, months for appointments for crucial operations, people living with chronic pain, for example, and those are being cancelled this week. And that is clearly having a real terms impact on the quality of life of many thousands of people right across the country. I have put that directly to a number of people on the picket line behind me this morning, and they have all said, to a man, to a woman, that they're sorry, they recognise the impact that the strikes are having, but they all point to a piece of work done by the Royal College of Emergency Medicine at the start of the year, which said that the current state of the NHS and delays to emergency care are seeing 500 people a week dying unnecessarily. They say that the current system is causing harm to patients, and so they've felt obliged to do something about it, and that's why they're on strike, even if they can accept that patients are suffering. I do say, though, I mean, it's just one patient among many thousands, but a woman came out a short time ago with an appointment leaflet saying, "I've had my appointment cancelled today," and I thought she was going to give the protesters an earful, but then she said, "and it's Steve Barclay's fault." Now look, that's just one example, but you can hear the honking as well. We're on busy Euston Road. You can hear that they're honking in support of the picket line. There is a degree of public support out there, even in spite of the widespread disruption. The doctors here are in fine voice. They've actually been singing songs most of the morning with witty taglines like, "Don't blame it on inflation, don't blame it on recession, don't blame it on the doctors, blame it on the Barclay." But behind all the humour is a serious message. They feel that for 15 years or so they've been underpaid, they've had real terms pay cuts. We can argue about whether that's measured by RPI or CPI, as you were pointing out, but the fact remains they have had a pay cut. They want to see that addressed by the government. The government, for its part, you just heard Stephen Barclay say, they think the demands are totally unreasonable and militant.